A new pilot program at Sault Area Hospital is looking to reduce congestion in its emergency department. The virtual home waiting room is designed for those with minor ailments to avoid spending extra time waiting among people with higher needs. CTV's Cory Nordstrom explains.
Waiting in the queue at an emergency department can take hours, and depending on the severity of your symptoms, that length of time can continually be increased. A new pilot program at the Sault Area Hospital aims to reduce those times for those on the lower end of acuity.
The emergency room is a very unpredictable environment, and our priority is, of course, always the highest acuity patients. And we don't want low acuity patients to have to wait a large amount of time in our wait rooms because they can be very crowded. And crowding, of course, as we know from the pandemic, can lead to a greater risk for infection and also decreases patient satisfaction and reduces our overall efficiency.
The virtual home waiting room is for patients who have at least one of these 9 symptoms, including earaches and minor cuts or scrapes. The hospital's website has the full details, and it's also where patients with less emergent needs can join the virtual queue. After inputting their information, they will receive texts on the hour of their spot on the list.
It is essentially lets them know that when they're told to come to the emergency room, that is the most opportune time to minimize their wait in the emergency room. But it's not an opportunity to skip the existing queue.
Even though the home waiting room is new, officials are satisfied with the early results.
We're only 1 day into this project, and the patients who did use it waited an average of an hour at home. And then when they joined to be seen in the emergency room, they joined our usual queue, and our average wait times have been around 3 hours.
Hospital officials hope to eventually expand the virtual home waiting room to include more than 10 patients. They add that feedback is critical to improving the pilot project and invite all patients who use the queue to review it. Cory Nordstrom, CTV News, Sault Ste. Marie.